Adults have the ability to make the decision to go get vaccinated. We're trying to tell them it's time to do that.
Back to our top story. Governor Pritzker announcing new mask rules in our state as COVID cases are 10 times higher than they were at our summer low.
Tia is back taking a deeper look at this story. Tia?
This is really serious. Masks are now required in schools and long-term facilities, and some state workers now have to get that vaccine. Dr. Shikha Jain with the University of Illinois at Chicago joins us now to talk more about this. Dr. Jain, thank you so much, as always, for joining us here on First at 4.
Thanks for having me, Tia.
Let's get into this. First of all, we know you give a lot of recommendations right to the governor. Did you play a big part in the new ones, and why are these new rules so important?
So there have been a lot of physicians and healthcare workers and parents who've been advocating for universal masking in schools. And we have data to back us up, and we've got the American Academy of Pediatrics and the CDC to back us up. So I think that the governor did a great job today in explaining why it's important to have universal masking in schools. And I think there were a lot of components that led to him making this decision. And it's backed by science, as he said, and it's the safest way to get our kids back into schools and keeping them in schools. So I'm really happy with this decision, as I know many healthcare workers, doctors, nurses, and parents across the state are very happy with this decision.
Now, we have heard from, obviously, city leaders on this in terms of Lollapalooza, but health officials now say nearly 500 COVID cases are linked to the Deer District in Milwaukee after the Bucks won. What does this mean for Lolla, and is this something we should be concerned about?
It absolutely should be something we should be concerned about. As you can see in the images there, just like the images we saw coming out of Lolla, people were close together, they were partying, they were yelling, they were screaming, they were celebrating. And whether you're vaccinated or not, there is still the possibility you can transmit COVID-19 to each other. And there are a lot of people there who probably weren't vaccinated at that Deer event that you mentioned and that you showed video of. I think it's important to remember that with this new Delta variant, we are seeing transmission outdoors as well as indoors when people are close together, when they're talking, when they're singing, when they're interacting. And with the new Delta variant, there is a 5-minute exposure risk is considered somebody who's been exposed to somebody with COVID, as opposed to the 15 minutes we've been talking about last year. That just shows you how much more contagious this new variant is. So yes, there are a lot of concerns because we're seeing around 500 so far cases out of that one event in Wisconsin. And now we're concerned that the Lolla event over this last couple of days is going to lead to a lot more cases.
Wow, some really good information that you pointed to there. Let's talk about this. You know, I'm no health professional, but I do know some people that are simply saying, I do not want to get vaccinated. We hear that time and time again. How do you have that conversation with people that are just hell-bent on not getting the shot?
So I'll tell you, I'm still having those conversations in my clinics, and my friends who are non-physicians are having those conversations in their communities. I think the first thing you need to do is you need to ask people, why don't you want to get the vaccine? See what their concerns are. A lot of times when I talk to people, their concerns are maybe misinformation they've read online, or maybe they don't understand why they should be getting it. Some people just don't know where to get it, and some people don't even know that children over the age of 12 can get it. So I think first asking people, why do you not want to get it, is the first step, and not being confrontational, not being rude, not being aggressive about it, just asking, what's your reasoning? And then pointing them to reputable sites. You can go to our impact4hc.com site, where we have a lot of myth-busting infographics. We have a lot of information there. I think it's really important for people to remember that everybody wants to keep themselves healthy and safe. Everyone wants to keep their kids healthy and safe. People aren't making these decisions because they're bad people. They might be making them because they're scared, or maybe they have some misinformation they've been reading. So try to allay their fears and try to get to their level, understand what their concerns are, and try to have an open and honest dialogue and conversation with them to explain to them that they're putting themselves at risk, they're putting others at risk, and help them understand why it's so important not only to get vaccinated, but also to be wearing masks indoors when our community spread is so high right now.
All right, you always come on the show and you always break it down. Dr. Jain, thank you so much for being with us.
Thanks, Tia.
All right, Anthony and Sally, I'll send it back to you.